Hi, my name is Brooke Fornetti, and I will be presenting on my senior thesis, Personality Correlates of Health Behaviors, an investigation of COVID-19 face mask and contraceptive use. So just a quick introduction, COVID-19 is the newest coronavirus and has quickly become a worldwide problem over the course of the last several months. It is a highly contagious disease, and not everyone that contracts the virus actually shows symptoms and is symptomatic, which is the reason that everyone needs to take precautionary measures, such as wearing face masks, which have been proven to slow the spread of COVID-19. In the US currently, mandates for social distancing and facial coverings have been put in place when interacting with others outside of your immediate household. Despite the mandates, some still refuse to wear the face mask for various reasons. And in fact, every population can be infected by this virus and experience serious and severe symptoms, including young adults and children. Young adults tend to have an invincibility complex that they eventually grow out of, which is the belief where they are invincible and nothing can hurt them, and in turn making some of them think that they do not need to take such precautionary measures about viruses such as COVID-19, and can cause further transmission of the virus and lead to more outbreaks. In addition, it can also cause outbreaks of other diseases like STDs and STIs when individuals do not take proper precautions like using condoms and other contraceptive measures. In this particular population, especially with college students, the prevalence of sexual activity has risen over the last few decades. This has led to an increase in research about sexual activity and condom use to help lower transmission rates of STDs and STIs. Within this research, various predictors such as self-efficacy and personal attitudes towards condoms and other contraceptives have been proven to influence individuals' decisions to use condoms. Currently, little research has been conducted to see if contraceptive use can predict the use of other disease prevention measures. And even less research has been conducted and published on predictors and variables associated with COVID-19 face mask usage due to the newness of the virus at the time of this research. However, looking back at previous epidemics such as the HIV and AIDS epidemic with condoms, it shows the importance of finding long-term strategies and ways to promote proper and consistent face mask use for everyone's safety. Currently, there needs to be research conducted on how to predict individuals' use or refusal to use COVID-19 face masks and how to promote their use. This is the hope with this research that is being conducted in my thesis currently. So the purpose of my study is to investigate the potential link between an individual's COVID-19 face mask use and the frequency of their contraceptive use. The hope is to aid in future research to promote face mask use and prevent or slow the spread of COVID-19. My hypothesis and theoretical findings are that those who report using contraceptives frequently will show an increased use in mask-wearing behaviors, and those that report using them infrequently will show decreased mask-wearing behaviors. At the current time, my thesis is still doing data collection, and I haven't had time to do data analysis, but my current methods are participants are undergraduate students from Alma College that were recruited through the psychology department and their psychology classes, and they received extra credit for their participation. The only criteria that participants needed to meet was that they had to have engaged in consensual vaginal sex at least once to participate. They were asked to complete questionnaires about basic demographics, their attitudes towards condoms, self-efficacy for condoms, and attitudes towards face masks.